Hello everyone, myself Dr. PARTHA Malakar, Assistant Professor, Department of Psychology, South Calcutta Girls College. Today I am going to present on state trait anxiety inventory.
State trait anxiety inventory. Introduction. First, we need to conceptualize what is anxiety. Anxiety is a diffuse, vague, highly unpleasant feeling of fear and apprehension. Individuals who are having symptoms of anxiety worries a lot. But when their personal, social and occupational life gets hampered, then they should be assessed with any standard measure of diagnosis of anxiety disorder. The interaction model of anxiety gets emphasized in the complex interplay between the person and the situation, which is practically important in respect to describing state anxiety and trait anxiety. Concept of state and trait anxiety was developed in 1970 by Spielberger et al. Work Spielberger and Hearn 1980 indicates state anxiety as the psychological and physiological momentary reactions that are directly connected to the unfavorable situations which happen in particular moment. In comparison to state anxiety, trait anxiety shows some kind of stability as it reflects personality traits. Spielberger et al. 1970 worked on the distinction between state and trait anxiety. According to them, higher the state anxiety, the higher the trait anxiety in various threatening situations. Though Endler and Parker differed from this view, and they showed that each scale needs to be conceptualized as multi-dimensional constructs. So despite of such controversies, Spielberger's state trait anxiety inventory, Spielberger et al. 1970, is now most commonly used self-report measures of anxiety both in research as well as in practice, Gaussian Porter's 2012. And these two distinct scales also have high internal consistency, Spielberger et al. 1970. Short description of the scales. STAI is a self-report scale that measures separately state and trait anxiety. The state anxiety scale consisting of 20 statements which evaluate how individual feels right now, that is at this moment. The trait anxiety scale, on the other hand, also consisting of 20 items, but they evaluate how individuals generally feel. So such differences should be very clear to the participant before they start giving this test. STAI essentially measures qualities such as feelings of apprehension, tension, nervousness and worry. This scale is most extensively used psychometric measure which has been adapted in more than 30 languages. Spielberger and Webb 1984. Adaptation of the state trait anxiety inventory for Bengali students was done by Chattopadhyay, Mollik and Spielberger 1986. Here you can see this is the state anxiety inventory or form X1, and you can see the directions or instructions are printed on it, and there are altogether 20 items, and each item is responded in one of the 4 categories. The categories are not at all, somewhat, moderately so and very much so. And here you can see this is the another form or the trait form X2, and here also the directions or instructions are printed on it, and here also there are 20 items from item 21 to item 40, and each item here also responded in one of the 4 categories mentioned. Scoring. For scoring, each item is given a weighted score of 1 to 4. A rating of 4 indicates the presence of high level of anxiety. Items which are having reversed scoring in both the state and trait forms are: for form X1, item numbers 1, 2, 5, 8, 10, 11, 15, 16, 19 and 20. But in group administration, it is helpful if the participant reads the directions silently while the examiner reads them aloud. And in form 2, the reversed items are 21, 26, 27, 30, 33, 36 and 39. Administration of the state anxiety scale, the participant will be urged to read the instructions carefully. Any question from the participant's end should be answered in a non-comical manner. That is, just answer what you feel right now. That is, at the moment. Further instructions will be provided to the participant not to avoid any item. It will be emphasized that he or she has to answer the way he or she feels right now. So, participants should be very much clear about the state of mind they should develop when they are answering the state and answering in state anxiety inventory, such as they should respond with a state of mind based on what he or she feels right now, that is at this present moment. So examiner should be aware, examiner should be very clear that his or her participant has developed such state of mind before they start, or before he or she starts giving responses in state anxiety inventory. Then after the administration of state anxiety scale will be administered. And again, any question from the participant's end will be answered in a non-comical manner. That is, just answer the way you generally feel. So again, the participant should be very clear before they start giving responses in trait anxiety inventory. Now the state of mind they should develop in responding to the items that what they genuinely feel. So based on such state of mind, they should start responding in trait anxiety state. Further instructions will be given to the participant not to exclude any statement. And again, if the test is used in any specific situation or time interval, in case of state anxiety scale, Keep it in mind in case of state anxiety scale, I repeat. And in such situation, the participant will be asked to answer on the basis of how they felt in the situation or at that time interval. And such situation, this thing also should be very clear to the participant that such time intervals or situation should be of recent experienced situation. That should be very clear to the participant. At the end, responses will be scored according to scoring standard. Keeping in mind about the reduced items as well. Scoring. For scoring, each item is given a weighted score of 1 to 4. A rating of 4 indicates the presence of high level of anxiety. Items which are having reversed scoring in both the state and trait forms are: for form X1, item numbers 1, 2, 5, 8, 10, 11, 15, 16, 19 and 20. And in form 2, the reversed items are 21, 26, 27, 30, 33, 36 and 39. The scores for the state trait anxiety are obtained by simply adding the weighted scores of the 20 items in each scale. In each scale, the minimum possible score is 20 and the maximum possible score is 80. And this one is the first approach. Scoring can also be done in another approach or in other approach, where both the direct and reversed items will be scored in a direct fashion and then subtract the value obtained in reversed items from the value obtained in direct items, following a formula to obtain the subscale scores. Here you can see this is a sample data, and here item number 3 is direct item, and you can see this response of the subject is 4, whereas and the score is also 4. But in reversed item, which is item number 1, you can see the response is 3, whereas the score is 2. So in this way, the score will be obtained for the direct items as well as reversed items, and then finally simply add up the scores to obtain the total score in each subscale. And similar method will be followed for the form 2, that is the trait anxiety form. And now I will discuss the other approach. What is done in other approach, you can see the direct item, which is item number 3, the response is 4 and the score is also 4. But if I consider item number 1, it is reversed item, you can see the response is 3 and score is also 3. So in this way, direct total score will be obtained for all the direct items, and then total score will be obtained for all the reversed item. And then these two separate totals will be put into the formula to obtain the scale score. And you can see the sum of weighted score for direct items is 23 here in this sample data, and the sum of weighted score for reversed items is 20. So 23 minus 20 is equal to 3. But here in this case, a constant 50 will be added with the obtained value. So 50 plus 3 is equal to 53. And similar method for trait anxiety as well. The only difference is, instead of 50, Here we will add 35 as constant. And finally, needs to be assured that in both the approaches, the scale score will be same. Now, the applications. The state trait anxiety inventory is applied for measurement of anxiety by assessing state and trait anxiety. STI has two forms, one for children and another for adult. STI may be administered to the people with various socioeconomic status. This inventory is used for the research purposes, and different groups may be compared on anxiety in respect to ethnicity, age and other variables. These are the references. Thank you.